Asthma also known as obstructive airway disease, bronchial asthma and reactive airway disease. Overview: asthma is a long-term condition in which air passages in the lungs become narrowed due to inflammation and contraction of the muscles around the small airways. This causes symptoms such as cough, wheezing, shortness of breath and chest tightness. These symptoms are intermittent and are often worse at night or during exercise. Some of the common triggers that can make asthma symptoms worse include viral infections, colds, dust, smoke, fumes, changes in the weather, grass and tree pollen, animal fur and feathers, dust mites, dermatophagoides, strong soaps, and perfume. These triggers vary from person to person. Key facts usually seen in children below 15 years of age. Body parts involved: lungs, airways. Mimicking conditions: vocal cord dysfunction, tracheal or bronchial obstruction due to foreign body or tumor, heart failure, gastroesophageal reflux disease, GERD, chronic sinusitis, chronic obstructive pulmonary disease, anaphylactic reaction. Necessary health tests/imaging: blood tests, CBC, immunoglobulin E, IgA, AMP, absolute eosinophil count, AEC, pulmonary function test, chest X-ray, allergy panel/asthma/rhinitis screening test, specialists to consult: pulmonologist, allergist. Treatment: corticosteroids, beclomethasone, fluticasone AMP, prednisolone, leukotriene receptor antagonists, montelukast AMP, zafirlukast, short-acting beta agonists, SABA, salbutamol AMP, terbutaline, long-acting beta agonists, LABA, salmeterol AMP, formoterol, methylxanthines, theophylline, anticholinergic drugs, ipratropium AMP, tiotropium. Symptoms of asthma: you may suspect asthma if you or your child are noticing symptoms such as coughing and wheezing, whistling sounds, while breathing. The symptoms of asthma can be characterized by breathlessness, shortness of breath, when exposed to triggering factors, cyanosis, blue discoloration of face and extremities, wheezing or whistling sound during breathing, chest tightness, which feels like a tightened band around the chest, intense coughing or the urge to cough that may be triggered by an allergen or other environmental factors, fatigue during and after an asthma attack. Causes of asthma: the exact cause of asthma is still not known. It is also believed to be a multifactorial pathology that is affected by both genetics and environmental factors. Ideally, when your immune system comes in contact with an allergen, it triggers an immune response to fight against the allergen. But in people with asthma, this immune response is very strong, which leads to inflammation. This in turn causes the airways to swell and become narrowed, causing it difficult to breathe. During an asthma attack, three things can happen: bronchospasm, the muscles around the airways constrict, tighten. When they tighten, it makes the airways narrow. Air cannot flow freely through constricted airways. Inflammation: the airway linings become swollen. Swollen airways don't let as much air in or out of the lungs. Mucus production: during the attack, your body creates more mucus. This thick mucus clogs airways. Asthma in children: according to the Global Initiative for Asthma, GINA, guidelines, around 300 million individuals worldwide, including both adults and children, are afflicted with asthma. As per the World Health Organization, WHO, India has around 15 to 20 million asthmatics. It is estimated that the prevalence of asthma in kids aged 5 to 11 years is between 10 to 15%. Most kids with asthma may not show any signs or symptoms of the condition for a long time or until they have an asthma attack. Moreover, in most cases, the symptoms of asthma in children can be confused with other respiratory illnesses. Hence, the diagnosis of asthma in kids is quite difficult and is based merely on the symptoms. Risk factors for asthma: genetics, air pollution, diet, viral infections, allergens, medication, exercise, chronic sinusitis, insects or plants, obesity, stress, smoke. Diagnosis of asthma: asthma is usually suspected if the patient has a history of recurrent dry coughing, particularly at night and early morning, along with other symptoms such as chest tightness, shortness of breath, and wheezing sound. Following are the diagnostic tests for asthma. 1. Physical examination: during a physical examination, your doctor might look at your eyes, ears, nose or throat for swelling or drainage, which may indicate allergic reaction. Also, checking your chest and lungs for wheezing or whistling sounds, which may indicate inflammation and contraction of airways. Blood tests: your doctor may recommend certain blood tests to check the level of inflammation, antibodies and eosinophils, a type of immune cells. These include complete blood count, CBC, immunoglobulin E, EEG, and absolute eosinophil count, AEC. Pulmonary function test. Pulmonary or lung function tests are done to find if there are any airway obstructions. In case there is clinical suspicion but the lung function test comes out to be normal, then other tests such as post-exercise test or allergen challenge test can help in determining bronchial hyperresponsiveness in adults. Chest X-ray. In severe cases, hyperinflation of lungs may be seen, which can be detected with the help of chest X-ray. Allergy panel/asthma/rhinitis screening test. If you are showing symptoms of asthma and an allergic trigger is suspected, then allergy diagnosis is generally recommended. The diagnosis of an allergy consists of medical history, skin prick test, and specific IgA, immunoglobulin group E, test. Treatment of asthma. The common treatment approach for people with asthma involves use of preventive medicines, also known as controllers, and quick relief medicines, also known as relievers, controllers. These medicines help reduce the swelling of the airways and prevent mucus formation. They are mostly used to prevent asthma attacks and protect the lungs. These medicine classes are 1. Corticosteroids. These are the best and most commonly prescribed drugs for asthma. They act by inhibiting the activity of the inflammatory compounds such as prostaglandins, leukotrienes, and histamines, which are responsible for inflammation. They are broadly classified into A. Inhaled corticosteroids, ICS. ICSs are amongst the most effective anti-inflammatory medications available to treat asthma. Low-dose monotherapy of inhaled corticosteroids is usually given as first-line maintenance therapy for most children and adults dealing with asthma. Regular use of ICS have been shown to reduce symptoms and flare-ups of asthma along with improvement in lung function. Example of drugs that belong to this category are beclomethasone, budesonide, fluticasone. B. Oral corticosteroids. These are generally given for the acute treatment of moderate to severe asthma. Prolonged use of oral steroids are generally avoided as it has been associated with potentially serious side effects. Examples include prednisone, prednisolone. 2. Leukotriene receptor antagonists. These medicines are effective for the treatment of asthma, are well tolerated and are safe to use. As the name suggests, they work by blocking the action of an inflammation-causing chemical messenger called leukotriene. These medicines thereby reduce the inflammation in the airways, preventing asthma and relieving symptoms of allergies. Common examples of these medicines include montelukast, zafirlukast. 3. Biological therapies. Biological therapies such as the anti-IgA monoclonal antibody, example omalizumab, can reduce the frequency of asthma attacks. This drug is given subcutaneously once every 2 to 4 weeks. This medicine is specific to patients with difficult-to-control asthma with an elevated serum IgA level. It is also given to people whose asthma symptoms do not improve even with ICS therapy in combination with a second controller medication. B. Relievers, bronchodilators. These are the preferred medications for the treatment and maintenance of acute symptoms of asthma and are generally prescribed to all patients with asthma. They work by dilating the bronchioles, thereby providing only temporary relief. These medicines are used to relieve the symptoms of asthma when they occur but not reverse the inflammation that has already occurred. Drugs that belong to the class of bronchodilators are 1. Short-acting beta agonists, SABA. These medicines are used for the treatment of asthma symptoms and its exacerbations. As the name suggests, these are known to provide quick relief. For example, salbutamol, which is the common drug, has an action onset of under 5 minutes amp, lasts for 3 to 6 hours. Some of the common examples include salbutamol, terbutaline, levobuterol. 2. Long-acting beta agonists, LABA. This class of medicines contain low doses of controllers and relievers with a long-lasting effect. These not only help you to relieve the symptoms but also protect you from asthma attacks. These medicines are often used in conjugation with other drugs such as corticosteroids. They have an action onset of more than 5 minutes but the effect lasts for at least 12 hours. Common examples include salmeterol, formoterol, indicatorol, olodaterol. 3. Methylxanthines. These are a new class of medicines used for the treatment of asthma. It is known to aid in the treatment of asthma by reducing airways inflammation and airway obstruction, which is seen in asthmatics. Theophylline is one of the most commonly prescribed methylxanthines. 4. Anticholinergic drugs. This class of medicines work by blocking the action of acetylcholine, a neurotransmitter which plays a key role in controlling the constriction of smooth muscles and inflammation. These are further classified into Short-acting muscarinic antagonists, SAMA, ipratropium is the common medicine that belongs to this class. It is used to treat and prevent the symptoms of asthma and COPD along with improving the breathing. Long-acting muscarinic antagonists, LAMA, tiotropium is the common medicine which is mainly used for the treatment of chronic obstructive pulmonary disease, COPD, and asthma. See other therapies. Bronchial thermoplasty is a bronchoscopic treatment using thermal energy to ablate airway smooth muscle in accessible bronchi. It may reduce exacerbations in patients not responding to maximal inhaler therapy. 8nine Healthify World. It's all about health, wealth and care by Kunal Rao Rane.